Since this time yesterday, we've seen a modest increase in case counts in Philadelphia, actually over the past week. So here are the numbers. Since this time yesterday, we identified 150 new cases of the coronavirus, bringing us to a total of 28,742. Now, the past week that ended last Saturday, we averaged 138 cases per day. That number could actually increase in the future with some delayed results coming in. That 138 is an increase from 110 cases per day in the week before. Now, we are doing more testing. In that past week, we averaged more than 2,500 tests per day, whereas in the past it was about 2,100 tests per day. But the percent of those tests that were positive has also increased. It was 5.5% last week, and the week before was 5.1%. And we've been between 5 and 6% since mid-June as far as the percent positive, but still the trend that there's any increase at all is concerning to us. I thought I'd give you just an update on the cluster that I talked about last week in the city's jail. Last week I reported that there was one inmate who had questionable symptoms who was tested positive, and that they tested then 64 inmates in that unit and found 23 with no symptoms who tested positive. Since that time, none of those inmates who tested positive have developed symptoms. No other inmates have developed symptoms, and no one else has tested positive. So we're hoping that that cluster is behind us. A little bit on testing. We are continuing to have problems with long delays from two laboratories, Lab Corporation and Quest, that do about 1/4 of the tests here in the city. Many of the testing sites do use those labs. We're still working on identifying other laboratories that can pick up those tests and redirecting tests to those other laboratories. More complicated than you might think. In the meantime, if people are tested, it may be a long time before they hear test results. Now, going back to the epidemic, in the region as a whole, we're seeing case counts rising in Bucks County and in Delaware and Pennsylvania as a whole. In the U.S. as a whole, the epidemic continues to increase. We're seeing high rates throughout the South, from Florida to Texas, from the Gulf of Mexico up to around Tennessee and North Carolina. Now, it's on a little more positive note. The rise is not quite as fast as it was a couple of weeks ago. And there's at least one state, Arizona, that seems to have peaked and it's on its way down now. But overall, the message is that the epidemic is not over. The virus is still here. It may be growing here in Philadelphia. We're going to have to learn how to live with it and how to manage it. So I thought I'd take a few minutes now to step back and talk about where we are with this virus, taking the big picture. The virus has been here about 8 months on this earth. So what have we learned and what does the future look like? So in individuals, we learned that this virus causes a wide range of severity of illness, more so than any other virus that I'm aware of. Many people with infection, maybe even most, have no symptoms whatsoever. They never know that they have the infection. Of those people who know they have the infection, who have symptoms, most of them, it's very mild symptoms. However, there is a very small percentage of people who have severe symptoms or can even have a fatal infection. Now, the likelihood that someone will have a severe infection is very strongly linked to their age. People with advanced age and people with chronic medical conditions are much higher risk. Overall, in the city, about 70% of the deaths that have occurred are in people over the age of 70. About 90% are in people over the age of 60. Now, we know at the individual level that wearing a mask, keeping a distance from people, and having barriers and other safety precautions can be very protective if people use them consistently. Now, in the community as a whole, we've learned that if we do a complete lockdown, the virus infection rates fall. That's what we did back in March. Lockdown happened around March 17th, March 20th. And about 4 weeks later, in the middle of April, the number of virus cases per day peaked and it started to go down. There was real success there. However, that success comes at a price. Without lockdown, you also see businesses that are hurt or that fail, layoffs and furloughs of staff, surges in unemployment as a result of that, social problems, and difficulty for everybody to get things done, from basic shopping to haircuts to educating our children. And there are health consequences to those job losses too. This virus kills, but unemployment also is associated with increased mortality. So unemployment kills too, and poverty kills too. On the other hand, if we just ignore the virus and let all activity start again, we know that the virus surges and then deaths from the virus surge as well. That's what happened in Florida. That's what happened in Georgia. That's what we don't want to have happen here in Philadelphia. So what we're trying to do here in Philadelphia, across the rest of the state, across the country at this point, is to seek a balance, trying to allow some activity to occur while limiting the spread of the virus. That's what our Reopen with Care plan is about. We allow lower risk activities. and we allow, but we try to reduce the risk of medium risk activities by putting in place as many safety precautions as possible. And then we prohibit high risk activities that really can't be made safe. So for example, we allow people to walk on trails, we allow people to go to stores and shop there, but with masks and with distance and barriers and the rest of our safety precautions. But we prohibit indoor dining, and we prohibit theaters, and we prohibit large events that are inherently high risk. Let's talk about bars and restaurants for a second. You know, those are sites that clearly have seen the spread of the virus as well as outbreaks in other cities around the country. And in fact, they may have been the driving factor behind the major epidemics that are occurring now in the South and in the West. Now, Philadelphia did not open restaurants to indoor dining when most of the United States did and the rest of Pennsylvania did. In retrospect, I think that was the right decision. Some people have asked how we judge whether a certain activity is high risk or medium risk or low risk. But I can tell you we look at a range of factors. Any activity that involves more people has a higher risk than an activity that involves fewer people. And the activity where people are close together is higher risk than activity where people are farther apart. Any activity inside is more risky than activity outside. Any activity where the masks can't be used, such as one where people are eating or drinking, is going to be higher risk than ones where people can use masks. Any activity where people are singing or yelling or really using their voices is going to be higher risk than activity where people are quiet. And any activity when there are vulnerable people, such as elderly people or people with chronic medical conditions involved, is going to be higher risk than activity with young, healthy people. Even that's going to be higher risk than activities involving only children. So that's how we use to determine the risk of any activity. And we may not get it quite right. We try to judge the best we can, and that's what our reopening with care plan is about. Now, at the last press conference, I got a question about school sports that I didn't answer very clearly, so I wanted to clarify that while I'm on this question about risk of activities. The guidelines we have on our website about school sports do not prohibit competition between teams. However, we do strongly recommend against competition between teams because of the close exposure of the participants involved, and because we're also mixing people from different neighborhoods who one group may pass the virus on to another group. And so we recommend that athletic teams focus on individual skill building instead of competitions. Any activity that a sports team is involved in, whether skill building or competition, has to follow the rules, which means fewer than 50 people at one time. That includes all the participants as well as the coaches or the referees, and that there's no spectators there, so no unnecessary people involved. Now, all that's about social distancing, but remember that social distancing is only about a third of our strategy for the epidemic overall. The other two elements are containment, which involves testing, contact tracing, isolation, and quarantine, and then protecting vulnerable populations. And that is trying to protect those people who are most likely to get a severe infection if they got infected with the virus at all. But no element of that strategy by itself is perfect. Each one of them is going to have some limitations to it. No element on its own can prevent the worst infection or make this epidemic go away. But all three together can keep the virus at bay and can limit the most severe infections, is what we care about the most. So what does the future look like from here? Well, if case rates rise, at some point we may need to close the medium risk activities again. I'd rather not do that, but if case rates rise, we may be forced to do that. If case rates fall, we may gradually allow these higher risk activities to resume with close monitoring to see if that allowing those activities to resume is allowing activity to start, the viral activity to start again. If the case rates are stable, we'll stay about where we are as far as what's allowed with safety guidelines, and what's not allowed. And let's be honest, we may have cycles of opening and closing as the epidemic changes around us and as we learn more over the next few months. At all times, though, we're always going to be emphasizing the safety steps to get as much as we can around them, particularly masks, like that image you have behind me, and distance and barriers, reducing crowds, and all the other things in our 8-part safety checklist. All this we're going to have to do until we have a vaccine. Now, I understand that this isn't very satisfying. We all want the virus to just go away, or we want to have just one single thing that we can do, like more testing or more treatment that'll solve the problem. But the virus won't go away anytime soon. And in fact, it's going to take a combination of actions in order to keep this virus under control. I do think, though, if we do that, we can live with it. We've learned to go on about our lives with this virus. We can continue to learn, and we can continue to manage this. And eventually, we'll put it all behind us. More information and all of our guidance is at our website. Go to www.phila.gov/COVID. Thanks.
Good afternoon. Dr. Farley, you have said that there are enough testing supplies in order to test the 5,000 people per day that you would ultimately like to see. I'm curious, why isn't there enough demand to hit that 5,000 test number right now?
Well, I'm not entirely sure. If people don't feel sick, they may, don't necessarily feel obligated to go in and get tests. And maybe if they're mildly ill, they have mild respiratory symptoms, they may not feel that there's a need to do the effort. We are working on media messaging about the need to be tested. We don't think that people who have no symptoms should go in and get tested, but we certainly want people who have any symptoms at all, or people who have been exposed to someone, to be tested. So we do want to encourage testing in the right folks.
Do you think these delays in testing results contribute to more COVID infections in any way?
They may be. Fortunately, it's only a quarter of our tests that use these labs that are so long. But certainly, if somebody is tested positive and doesn't know it, they're probably more likely to expose other people, and then they may not be aware of it. So it's certainly it is a problem. It's a national problem because these labs serve the entire country. It is hurting the overall response.
Yeah, this question is for Dr. Farley. Dr. Farley, some people say there are still disparities between testing for minorities and those in the white community, and that people of color are waiting longer to get tested, and it's much more difficult for them given the hours of the sites and so forth. Do you think the city's done enough, and what's your position on what you guys have done and to support that?
Yeah, we certainly want to make sure that we have adequate access to testing for the populations that are more affected. So African Americans are more affected, Latinos are more affected. However, our numbers so far look like we have reached them. We have numbers on our website, and I think that we have about twice as many African Americans as whites who were tested so far. Latinos, maybe a little less, maybe more average as far as on a population rate basis. We can always do better. We're particularly interested in people who may not have that much money, may not have insurance, may not have cars. We're trying to improve our access to testing through contracts with a number of organizations. We'll set up additional testing sites. But so I think so far we've done fairly well in trying to make access available with the resources we have overall.
Dr. Ayla Stanford with the Black Doctors COVID-19 Consortium says that, she thinks there's a reluctance for people of color to come to some of those testing sites in this city. Do you think the city needs to do a better job, and how difficult is it for the city to maybe get more people of color, nurses, doctors that could maybe administer those tests and maybe get the word out that it's okay, you can go to these sites? Do you think there may need to be a better PR campaign?
Well, I do think we need to do more. And the more things that we are doing is, number one, we're putting out contracts with other organizations to do more testing. Dr. Stanford's organization is one, but there are others as well that are getting contracts to set up additional test sites. And we are working on a media campaign to encourage people to get tested. And certainly that media campaign is going to be focused on the folks who are greatest risk, where it's going to be African Americans and Latinos and people with minorities in general.
Hi, yeah, I have a question related to the heat emergency for Dr. Farley or whoever's best equipped to answer it. So there are 10 cooling centers in the city, but none of them is in South Philly. The city's heat vulnerability index has identified areas in South Philly as high priority areas for intervention. So how did the city determine the location of the 10 cooling centers?
Doc, do you know?
I think Derek is going to answer that.
Yes. So, so we looked closely, recognizing that we have limited resources at what sites made sense. Certainly not a perfect solution, but we looked at areas that had high heat vulnerability, maybe didn't have access to spray grounds, and kind of balancing where the facilities we were able to get open at the libraries and the schools were. So recognizing it's not a perfect solution. And I will say the cooling centers are only one part of the overall approach, as the mayor alluded to, using the heat line from PCA, checking on friends and neighbors. Those are all actions that we would recommend regardless of the situation.
Liz, let me unmute you. Were you finished?
Yeah, that's it. Thanks.
Okay, very good. Thank you, Derek, and thank you, Liz. Let's go now to Argenis Figueroa of Univision.
Dr. Farley, amongst the general public, there are still some doubts as to the use of the masks, and some of the parents are saying that they will not send their kids to school or to in-person activities if they have to wear the mask due to probable complications and damages to their bodies that could lead to asphyxia. What can you tell those parents that have those ideas about the use of masks?
The masks are completely safe. They're not going to cause harm to anybody, and it's going to be much more dangerous if their children do not wear a mask. Dangerous to the children and dangerous to the people that are around that children. So I think this is probably more just that people aren't accustomed to the mask than they are actually than there's any real risk to the mask. So at this time, we just can't get the message out there consistently enough. Wear a mask when you're around other people. We're going to have to be in that circumstance until we have a vaccine.
Okay.
Hi, Dr. Farley. Thanks for clarifying the interscholastic sports in the beginning, but I just want to nail down, you said the competition, the amount of competitors would be limited to 50.
Correct.
So
and the amount of people total, that includes the competitors as well as the coaches.
Coaches, officials. So does that basically mean something like football or soccer won't be allowed?
You who know more about sports than me can tell me whether you can have a football game with 50.
An average roster of one football team is probably more than 50. So
if they were to do that, they might have to have a smaller roster if they wanted to do that. Now, again, I want to emphasize, we're not recommending the competition. We're recommending instead they do skill building, but it's not prohibiting it. Clearly, if it takes place within those guidelines, it's going to be a very different sort of game.
So any game has to have less than 50 people total in the participant.
Correct.
Okay, and just one other thing with the schools, with the reopening, is there a protocol in place for what if a student or a teacher were to test positive?
There is. I'm not sure how much is details been written down, but certainly we've had the schools planning around that. We are planning around that to do contact tracing and put give instructions for the proper people to quarantine who have been exposed.
And one last follow-up. So is there any chance of any of this changing, like the 50 participant number being relaxed between now and football or soccer season?
There's always the possibility that any of this could change. As the virus could get worse, things could get better. What I can tell you is where we are right now. And I know that's frustrating. People wanted to be able to predict what's going to be like in 2 months, but we just don't know.